Niacin is one of the, again, top 2 supplements that I recommend. Niacin is the only thing that decreases LDL, decreases triglycerides, increases HDL. You just don't find other things that do that. One other fairly important thing, it decreases Lp(a). I had a patient once that had Lp(a) it was close to 100. It was not a huge amount in terms of what I tend to see with my patients that actually have significant problems with Lp(a). But this patient's Lp(a) went down to 25 just on 250 milligrams. I've got a whole series of videos on niacin. One of the things that you'll find is there were a couple of studies that were done looking to show the benefit of niacin on cardiovascular risk. Unfortunately, those studies, I think one of them was the HPS2 Thrive, and I forgot the other one. They used a chemical called lopropiant to decrease flush. And for those of you who are not familiar with what I'm talking about, there's some long-term and pretty rare problems in terms of liver function. Yes, as with anything including water, sugar, air, can be a poison if taken in the wrong types and places. Niacin can as well. It can cause liver damage. But by far, the most common problem with niacin is that it causes what we call a flush. And I remember taking my first trials of niacin, 30 years ago, 20 years ago, and I was sitting in a choir area, and it felt like somebody had taken my scalp and they were just burning it right off. And I couldn't stop. I was just fidgety and, oh my Lord, that's called the niacin flush. That happens because niacin has an impact. It's similar to what we call a prostaglandin. Prostaglandin, it's a medical term if you haven't heard it before. Prostaglandin is for something that acts like a hormone, but it acts locally like a hormone, and it may not be a hormone. Niacin has a prostaglandin effect, expanding the vasculature, the arteries and veins. And to get back to the story about AIM-HI and HPS2 Thrive studies, they used lopropiant because lopropiant got rid of the niacin flush. Well, it also got rid of the niacin positive impact as well. So I also did a video where the principal investigator of that study said he covered his work, and he said, the result of this is going to be that a lot of people stop taking niacin. And I did the study. I'm the principal investigator, and I can tell you that's a big mistake. We know that niacin works. We've known this for decades, and it's unfortunate that this is probably going to be misinterpreted. And again, if you have more interest in it, just look up my content and my niacin studies.